This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
So a quick medical minute. We fortunately don't have to take care of a lot of very sick pregnant patients. It's not often that we get a pregnant patient who is, in cardiac arrest or extremis, but it is good to have a little framework of things to remember when we're taking care of these patients. So these are a couple things to think of when you've got patients who are later in pregnancy, 20 weeks and beyond. So there's a nice little mnemonic I heard recently, and the mnemonic is TOLDD, TOLDD, and here are the couple things that it stands for. So the T is for tilt. I think we've all been kind of told that when you have a pregnant patient, you need to tilt them. Which direction do we tilt them? Left. To their left, because we want to get the big uterus off of their IVC, which is on the right side. So you kind of tilt them on the left. That can increase cardiac return, increase venous return, getting more blood back to the heart, and can improve their kind of circulation. If they are in cardiac arrest and they're having CPR, you can't really tilt them on their left. That's not really ideal. So what you can do is you can have someone actually pull the uterus towards their left side. So that's the T. O stands for oxygen. Isn't that different than, what you would do for most sick patients? Later in pregnancy, patients do have very high oxygen demands, especially when they're sick. So just think about making sure they've got supplemental oxygen. The L is for lines, which is interesting. If you've got somebody who's sick, sometimes we'll put in like a tibial IO or a femoral central line. But because of that uterus sitting on the IVC, lines below the diaphragm might not have as much effect. So upper just extremity arm IVs are probably ideal. If you can't get that, then consider a humeral IO or potentially an IJ or a subclavian central line if need be. The D stands for dates, and to think about first, if they're above 20 weeks, you can consider a resuscitative hysterotomy, or what used to be called a perimortem C-section, which when you've got a pregnant patient who is, potentially in cardiac arrest or near death, getting that baby out can significantly improve the chances of survival. And after 20 weeks, that's something that can be beneficial. How do you know if someone's above 20 weeks? Where do you look for the umbilicus? Where do you look for the uterus? At the umbilicus. And then it's 1 centimeter above the umbilicus for every week after. After 24 weeks, you might even be able to save the baby as well. And then the last D you can think of as delivery, called labor and delivery. Obviously, that's something that we're used to doing here when we have a sick pregnant patient. Yeah, but more help, especially from specialists, would be very good. So any questions or comments about TOLDD? All right, thanks everybody. Have a good day.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.